Welcome to Ask Dr. Ting. We are here to help you improve your dental wellness as well as your overall health. Remember to press the subscribe button to get all our latest updates. Today, we are going to talk about
scaling and root planing. An ounce of prevention is worth a pound of cure. This is the best way to describe the benefits of scaling and root planing. Severe gum diseases require invasive and painful procedures. Scaling and root planing is one of the most effective ways to treat mild gum diseases before it becomes severe. Scaling and root planing. For scaling and root planing, everything between the gums and the teeth down to the roots inside the mouth will be cleaned. An ultrasonic tool will be used for the procedure, which may be less uncomfortable than a standard scraping tool. Depending on the severity of the plaque and tartar buildup, the diagnosis will identify the most appropriate tool to be used for the best results. Once scaling is completed, root planing will smoothen all rough areas on root surfaces to keep bacteria, plaque, and tartar from re-adhering under the gum line. As part of the procedure, a local anesthetic to numb your gums and the roots of their teeth may be used. In some cases involving highly aggressive oral bacteria, you may also be prescribed some antibiotics. Following the procedure. To ensure quick and effective healing, and to maintain the overall health of the gums and teeth, you should brush and floss regularly. This will have a big impact on halting the effects of gum disease. While the healing takes place, smoking or using chewing tobacco should be stopped if possible. The use of any kind of tobacco reduces your ability to fight infection and slows your healing process. Scaling and root planing produces little or no discomfort. Once recovered, swollen gum tissue becomes firm and pink again. The progression of gum disease can be stopped, and the troublesome pockets around the gums are reduced. This creates an environment for the gums to heal and can stop gum disease from progressing. However, if there is moderate to severe periodontitis, scaling and root planing may not be enough to completely eliminate the periodontal disease. Most patients will need minimally invasive laser periodontal surgery. Here, at Think Oral Implants and Periodontics, we can customize your periodontal care to meet your specific needs.
if you are interested in improving your dental wellness and overall health. Remember to press the subscribe button for upcoming tips and strategies. Join us again soon for more updates.